talking with her, by the way. Now, a lot of times we have kids that are really bright, and sometimes the parents refer them, not the schools. This was a boy who was in the first year of a gifted class in 3rd grade, and his parents brought him in because even though he was getting B's, he couldn't get his test done in time. He couldn't finish test, and then homework was taking him like 4 or 5 hours in 3rd grade, and he was very slow. He had a hard time getting things done. And one of the things we saw is his IQ was 140. That if it's above 130, that would be considered gifted. His IQ was way up here. And the brighter you are, the higher your IQ, the higher your attention scores, just like the higher your reading scores would be. His attention scores were only 80 and 85. His speed score, his processing speed and reaction time when he was listening and watching was only 73. 73 compared to 140. That's like the difference between an F and an A. That's a huge difference. He could still bright, he could still do well in school. He wasn't hyper, he wasn't impulsive. We did neurofeedback with him. The treatment we're going to talk about, his speed improved, his attention improved. He was able to finish testing, get his homework done. His grades went up. He was still very bright, but his grades went up. Now, when we start doing this with autism, what we found, this was an extremely difficult test for autism. There's even a simpler version of this test. Instead of hearing numbers, you only see different designs, so it's only 2 transitions. You push it and you don't push it. This is a harder test. There's 4 transitions. You hear and see a 1 and hear and see a 2, and they switch all the time. So children with autism have a hard time with transitions, switching quickly. So most of our kids with autism cannot get through this test. They get these invalid scores. They come out really low. They either get confused and they can't get through the test, or they'll just focus on one number. Like they might focus on a 1 they hear and ignore the ones they see and ignore the 2s altogether. And they get really low or invalid scores. So we redo these tests over and over when we treat the kids with the neurofeedback. And one of our goals is to get them to be able to transition so they can take a test like this and get a valid score. And we can usually do that as we go through the neurofeedback even halfway through. Now, one of the interesting things happened is when we started to give this test to people with Asperger's. Remember I told you the reaction of kids with ADD? Oh, I hate that test, it's boring. So the students with Asperger's, this happened to me last week, they'll come up and say, Dr. Linden, thanks for letting me do that really exciting test. Can I do it again? I remember the first time I heard that, I almost fainted. I'm like, what? I went back, did you give them the IVA test? They over-focus, they're detailed, they like these tests. They do above average on the test. They'll try to count the number of 1s and 2s during the test. I had one boy who ended up going to Harvard actually tell me he thought he even found a pattern in the test. There's no pattern, it's random. But within the test there's little patterns every 30 seconds, and he found one of those patterns. So this is the overfocus. And you can kind of see even how they're different. But the most accurate, most important test is the EEG test, like I was showing you that we did in that doctor show. So when I say EEG, some of you might be familiar. EEG is the electroencephalograph. Those are your brain waves. All of you have brain waves. Even if you're really tired, you have brain waves. What would happen if you didn't have brain waves right now? You'd be dead. You know, you'd be flatlined like you see on kind of the medical shows. So this is looking at one channel of EEG. In the 80s, we didn't have really good computers, and we started to look at the brain waves one channel at a time. And this is the raw EEG. This is a 2-second example, 1 second, 2. And you can see there's some big brain waves. When they're real big like that, that tend to be real slow daydreaming brain waves. And there's some real fast brain waves that have to do with paying attention. What we found in the 80s and 90s, and we did some research on this, we found with children and young adults with ADD, most of them had very high slow brain waves, which are to the left, and very low, too low attention brain waves. I explained the EEG is like the speed of your brain. Just like the speed when you're driving a car, you want to stay in the speed limit, right? Your brain waves, if you're paying attention, you want to be between 12 and 20. Those are called your alert or fast brain waves. They have names like SMR, which is if you're really calm and paying attention, probably like you are now, or beta. Beta is like when you're really alert and paying attention. When you drink coffee, it increases your attention, you're in beta. When you watch sports and they say the athletes are in the zone, they're in beta. Matter of fact, we have athletes that do the neurofeedback treatment. We call it mental fitness training, and they do it to condition their brain more automatically and more long-term to stay in this focus state, because even elite athletes can't do that every single game. What we found is that the brain waves, you see the numbers here, these slow brain waves between 4 and 8, this big black brain waves here, you see the real high bars, that's theta. Theta is right next to the sleep brain waves called delta. When you're in theta, you're daydreaming, you're drowsy. Now at evening, where we are now, that would be kind of normal. But, you know, between 9 and 12, most people should be awake and alert. So people with ADD, their brains look like they're sleeping. Their theta, their daydreaming brain waves way too high, and their beta, their attention brain waves too low. For an adult, their theta twice as high as their beta is high. For a child, this can be 10, 15, I've seen them 20 times as high. What we found in the 80s and early 90s is when we looked and we did research, 90% of people with ADD from age 5 to about 30 had this pattern. So it was a really accurate pattern. We were able to predict this, but when we started working with adults that had anxiety and depression or Asperger's and ADD, we didn't see this pattern as much. We knew we needed to refine the test to include all these things. When we used to do our analysis, we would look at the daydreaming, like this is an adult, the daydreaming was 9, the attention was 3, it was almost 3 times as high, it was higher than 1.5 times, that was an ADD pattern. And these we published in journals, 2 journals called Neuropsychology in the 1999 and 2001. I think we have an abstract of some of those on the table if any of you want to look at any research articles. So, but we realized we needed a better test. So about 10 years ago, we kind of start doing the test called a QEEG brain map. And the brain map is all the areas of the brain. And we do the same type of hookup like a neurologist does. As a matter of fact, we have technicians often that work for neurologists work with us in the weekends when we do these recordings. Now that we can have 19 electrodes, we can look at so many different combinations. We can look to see if something's abnormal, if it's unstable, if it's not communicating, if it's on the left or the right or the front and the back. We can look at so many different parts of the brain, and there's all these databases we look at, and we're comparing brain waves when people close their eyes and they open their eyes and they're reading and doing attention tasks. There's norms for brain waves and EEGs from childhood up to adults that are elderly. A couple of nice things about this. There's been research since the 1970s, and one of the biggest centers and the norms we use are from New York University's Brain Research Lab. Secondly, this is a totally safe, non-invasive procedure. There's no radioactive IV. There's no needles. You don't have to keep your head in like an MRI tube, because lots of the young kids get scared of the IVs. It's hard for them to sit still. Sometimes when they have to do like an MRI, they have to sedate some of these kids, but we don't want to look at brain functioning with kids sedated, so we really can't do that to look at how their brain is functioning. So this is a very safe procedure. There's no radioactivity in your brain that's going to set off metal detectors in the airport like some of the other studies do. So it's a very safe. You're sitting in a chair, you open your eyes, you close your eyes, and you read. Pretty simple. We can test children as young as 4 on this test. Looking at this QEEG, we have confirmed what other researchers have found at New York University, that there's 4 subtypes of ADD, and I'll show you 7 of autism and Asperger's. I'll explain them and I'll show you some examples. The first type is an inattentive type. This is what a lot of girls and women have. They're daydreamy, disorganized, kind of slow, distractful. Maybe they're talkative, but they're not really hyper. The second type is the more classic ADHD hyperactive type. You're fidgety. ADHD, by the way, you can be hyperactive and or impulsive. You can be one or the other or both. And then we have a type that's kind of over-focused, that has anxiety with it, and another type that's more depressive. So you're probably saying, okay, what's the big deal about all these types? Why do I need to do these? The reason is each of these types responds to a different treatment. Each of these 4 types will respond to a different type of medicine. Each of these types will respond to a different type of neurofeedback. That's why we want to do it. We don't want to have somebody like the boy they referred to me in the show that they're giving medications without even knowing what type he has. You want to individualize it to the brain and not guess based on the symptoms. Because all these symptoms, believe it or not, if you and the teachers filled out a questionnaire, could look exactly the same on the surface.